The next speaker is Professor Neil Brusselers, who is a professor in clinical epidemiology at Antwerp University in Belgium and an associate professor at the Karolinska Institute in Sweden. She will be talking about evaluation of science advice during the COVID-19 pandemic in Sweden. Over to you, Professor Brusselers. Thank you so much in advance.
Thank you very much for having me. I feel very honored to be here among this list of very impressive speakers. So, as said, I'm a clinical epidemiologist, I'm a medical doctor, and I also did an extra training in hospital hygiene infection control. So, although I never worked with pandemics before, I think very few of us have before COVID arrived. I do have quite some experience also working with hospital infections and the microbiome. So this is a paper that we published a few months ago, and it's actually part of a big consortium led by Professor Pielke in the United States. And many countries are doing a similar thing, evaluating the policy, how science affected the policy in their country. The Italian one and the Philippines are published and several are in press. So it's actually quite interesting to compare how it happened in the different countries. This has been our team, so we were quite diverse, even a human rights journalist, some researchers, medical doctors, and luckily a really nice team of people, and we worked really well together. We actually didn't know each other before the pandemic started, I think none of us, but now it feels that we became friends over the years, so that's very nice. I was actually also involved in another paper where we compared the different epidemiological numbers, but also health policy and the economical numbers in the whole Nordic region, the region most comparable to Sweden. But today, for me, I didn't have experience with policy before. I was a real hardcore scientist, sitting behind my computer. But then what is policy making? Actually, it's basically the process of making plans, decisions. It could be on a governmental level. It could also be in a hospital. So, it's basically the people deciding what should be done. So how does it happen? Now, to take the example of Sweden, there is advice from the WHO. In Europe, there's also the advice of the European Centre for Disease Control, so the equivalent of the CDC. A little bit different because, it's a different region. And in Sweden, you also had the Public Health Agency of Sweden, so a governmental agency, and they are supposed to give advice to the government. So let's make it easy, the politicians, the government. But besides that, you have the whole scientific community. And I'm one of those. I don't have any ties with the Public Health Agency or any governmental agency, not in Sweden, not in Belgium. But we do interact, we do publish our papers in an official way. Sometimes scientists can be advisors for those organizations, but very often in an unofficial way. Also in Sweden, we had actually formed a big group of researchers who found each other to discuss everything going on in Sweden as well. But now let's look who is most affected by this pandemic, to just put everything in a bigger perspective. So, of course, healthcare, economy, and society. In the society, we, of course, especially in the beginning, thought about the elderly. We have the vulnerable. It could be due to medical conditions, but also because, socioeconomically, migrant status, all those things which may make a person more vulnerable to get ill and not to get the most optimal healthcare. Children are always very well affected. The healthcare personnel, of course, they could become patients as well. And then the young and healthy. If I look back at the pandemic and the policy in Sweden, I would actually say that this young and healthy group was the one that was most important for the decision making in Sweden. I'm a medical doctor, although I don't work clinically. For me, that feels still a bit counterintuitive. Because, you should take care of the weakest. Of course, you should take care of everyone, but that's how it is, I think. There are many well-established key scientific facts. I even put there the open door, and several of them have been covered also in the previous talk. And actually, many of them some of them are still a bit ignored in Sweden, but actually all of them have at a certain point been ignored or that it didn't really matter. So, for example, face masks were not recommended in Sweden for a very long time. Children, it was said that they could not become ill. Long COVID, also one of the talks this morning, was also not really a thing. One of the other things, herd immunity. Probably the underlying reason in Sweden for the policy well, it was already very clear in the beginning that it would not work, especially not without vaccines, because, well, we knew from the start that many people could get infected more than once. And it's never been admitted in Sweden, but it's actually quite clear from the actions and decision making that it was most likely the underlying idea. So Sweden, it's a very big country. It's 1,500 kilometers length. So if you compare it with Singapore, which was introduced earlier, it actually has only 10 million inhabitants. I'm from tiny Belgium. So Belgium, same as Singapore, is really central, a lot of traffic flying in, flying out, but also road traffic. Sweden doesn't have that. Sweden has a very long border. It's basically only bordering with Finland and Norway. And especially in those regions, it's not that densely populated. The social structure compared to many other countries is also not that dense. You don't have those big families with multiple generations partying together or living together. So it's quite a peculiar setting, region. And I guess, Sweden is most comparable with the other countries in the Nordic region. And I'm going to come back to that because, Sweden has been comparing themselves with many other regions and usually, pointing out like, oh, but Belgium or any other country was still doing worse than Sweden. This is a bit of a timeline. So as we all know, it started early 2020. It started in Europe, in Italy. So then it was spreading out in the rest of Europe. And in Sweden, it was early March that we had the first death. And that's also when the WHO declared it as a pandemic. It came all a little bit later in the US, but here it was really in March that things were booming in Europe, booming in not such a good way. So to give an example, everything went quite slow. So just to give it in how I perceived it, like in Belgium in the media, everyone was quite shocked what was happening in Italy, the ICUs which were full. Many people were panicking. The hospitals were preparing because it was just spreading and it could hit any country. In Sweden, they were like, it's probably not going to happen here. The numbers are decreasing. That's what the state epidemiologist said. And that was for me the first warning sign. He was saying the numbers are decreasing while the reported numbers were going up every day. What is he saying? But like here, around March 11th, it was finally that they banned big concerts and everything bigger than 500 people. At that time in Germany, you were only allowed to go outside with 2 people. So in Sweden, it was still 500. Okay, later in March, it was lower to 50 people. But on March 7th, just a couple of days before, they had a huge musical event in the biggest arena in Sweden with almost like 30,000 individuals. So it was already a big discussion. Like, no, shouldn't they cancel it? No, it moved on. So if you look at a few other quite important time points, it was only towards the end of April that the hospitals and elderly homes were provided with hand disinfectants. So still no mouth masks were discussed in other settings as well, but it was end of April that they were providing hand alcohol. And not until the end of August before it was even possible to test children. So in the meantime, quite a lot of other things happened, but not to an extent as in all the other countries, basically in Europe. Things did change. They recommended for the elderly, so those above 70, that they should try to isolate themselves. And many people were working at home. It was never mandatory. There was no lockdown. But many people did start working at home, especially those with the summer houses. And of course, those people who had jobs allowing to work at home. So many people, if you didn't have a job like that, if you worked in public transport or anything, you didn't really have that choice. This figure comes from our other paper, the one of the Nordic region, and the yellow line on the figure with the deaths, that's Sweden. The number of hospitalization, Sweden also clearly stands out. And actually, the only one graph where Sweden doesn't top the charts is the number of testing. So you would think there is the highest number of cases happening, so they would test more than Sweden. So I actually think that Sweden was the only country where they actually had the testing facilities available, where they didn't prioritize testing. So in many countries, it was a problem. They didn't have the facilities, but I was working in the department or in the center even, where they were providing all the testing capacities. And it took months before they were used to full capacity. And just bureaucratic reasons. They had everything ready and it was just not used because the testing was just not performed. But you see it in the numbers that Sweden is clearly different, adjusted for, of course, population size So it wasn't the best one in the class of the Nordic region. So what's the scientific advice in Sweden? It actually only came from the Public Health Agency of Sweden. The picture here on top, that's a state epidemiologist. So in Sweden, they have a state epidemiologist. That's a governmental officer, basically. So it was an agency, but Anders Tegnell was really the face of this organization. And the text underneath the picture, tvätta händerna, means wash your hands. Working in infection control, now the statement almost gives me shivers, because that was the advice throughout the whole pandemic, basically, wash your hands and nothing else. But yeah, important to know, this government agency is not independent. There was never a true scientific advice. There were never really independent advisors as well. So it was a bit difficult to see how WHO and ECDC advice was often ignored. So these were the recommendations. It was in 2020 and early 21. Basically, stay home when ill. So not stay home when you had a high risk contact, not stay home when your spouse or your child is infected and heavily ill. Actually, it was even allowed, if you had symptoms yourself, to pick up your kids at school. So asymptomatic and pre-symptomatic spread were quite ignored. To say another fact, the state epidemiologist actually said that, we in Sweden are good in contact tracing because we do that for chlamydia. It sounds ridiculous, I know. So contact tracing didn't really happen. So staying at home in that pre-symptomatic period didn't really happen. Keep your distance. That is something that the Swedes do automatically, I think, at least more than in many other regions. And the wash your hands, very important in infection control, but for airborne infection, it seems not sufficient. This is actually the chart that the Italian colleagues made. So with different partners, how the communication worked, who advised whom. And we initially attempted to do the same in Sweden. These are actually the 3 governmental agencies in Sweden. And you had some other bureaus, I'm not showing them all, but then, for example, the National Board of Health and Welfare, they collected data, Statistics Sweden as well. And then you had 2 organizations which actually evaluated the corona policy making and everything that happened. That was the last report came out a couple of months ago, and they were not too positive. They were actually quite critical. Besides, you had, of course, scientists. I especially point out Karolinska Institute, where I work. Also to point out actually that the Public Health Agency is located at the same campus. So many of the people who appear to be independent advisors or scientists, they actually had close links to the Public Health Agency. And then University of Göteborg, there were also a few researchers who really were visible in the media. And then you had the Royal Swedish Academy of Sciences and the newly established group of researchers. They were established also early in spring 2020. And I also became part of it. We actually found each other because we were getting quite upset of what was happening in Sweden and why the science advice was not formed. So this became a group of researchers, medical doctors, who tried to communicate science to the public on what was happening. But in reality, no flowcharts with nice arrows. It was really Public Health Agency of Sweden deciding, and basically the only voice throughout the whole pandemic. It became a bit of a cult status, I must say. So this is the state epidemiologist again. So there were huge Facebook groups of thousands of people. Even my colleagues in Karolinska were in this Praise Anders Tegnell Facebook group. So that was a bit weird, I must say. But also from the start, there were lots of researchers, scientists, and also people quite upset, what is happening here? And I put this red line here because it was a clear polarization. And there was basically no discussion in between 2 groups. It was really thing, the Public Health Agency is right and should not be questioned. And that personally, as a researcher working in university, I thought was really scary, especially at work, I must say. So a discussion was not really possible. But let's give an example on the mask wearing. So this is a graph of September 2020, almost a year into the pandemic. Only in Sweden, in the whole Europe, they recommend it in certain places, not in Sweden. In healthcare and on public transport during rush hour, it was recommended in January 21. So basically a year after everything was really getting out of control in China. And this is a picture of the state epidemiologist from February. So even the state epidemiologist and other officials were not adhering to their own recommendations of wearing a mask in public transport during rush hour. So a lot has been written from the start, people promoting the Swedish approach, people really, actually the opposite. Here we see the state epidemiologist Tegnell and the former state epidemiologist Giesecke, who were also saying like, oh, all the other countries are doing wrong. Ireland, they should let everyone get infected. And there were quite some emails from the start where they were discussing like, oh, maybe we should use it children to get to herd immunity faster. In Sweden, you can get all those emails. There's a law for openness of information, so all government officials are obliged to provide their emails when people request. So all those emails became public. And then behind the scenes, they were saying, oh, we can use the kids to get to herd immunity, while publicly they were saying, oh, kids cannot get ill. And there has been a very strong, like, oh, we don't wear masks in Sweden. Oh, masks are dangerous. Oh, they create panic. They cause acne. That was on the official public health agency website at a certain point. So, yeah, we shouldn't wear masks. It's not in our culture. They also said things like, oh, I don't think there will ever be an outbreak in Sweden. The picture here at the bottom is the health minister. She publicly said that, oh, the government did not have a strategy. Our strategy was not to have a strategy. They didn't prioritize data collection. And yeah, there were also some other things which were a bit smelly, I must say. Yeah, of course, it had consequences. Many people in healthcare quit. They already had a huge shortage, especially in nurses. But then, yeah, it was even worse during the pandemic and afterwards. At schools, so by not promoting masks, actually many people did interpret the rule as masks are not allowed. So I know about a physician who was fired because she was wearing a mask. A friend of mine, they took away his mask when he tried to enter a lung clinic because, oh, we don't wear masks here, you're not allowed to wear one. Same in schools. So also in schools, kids were not allowed to stay home, when they were at risk or when parents were at risk, because otherwise they were threatening with fines. So yeah, it all sounds so shocking. It seems a bit of a parallel universe with the other talks before. But yeah, of course, it had its consequences. And also in the care homes for the elderly, many things went wrong. It has been very well documented that the elderly did not get the care they needed. So what do I think was worst? So yeah, you see, I'm not a real fan of how Sweden handled the pandemic. So in the elderly homes, the elderly were getting morphine instead of oxygen treatment or any other treatment, and they were not even examined by physicians. Okay, it did not happen in every elderly home, but it happened in multiple regions, so it was not a single case. And even if it was only a single case, I think it would be not good. The healthcare workers were not allowed to protect themselves. So people, even if they bought their own masks, they were not allowed to wear them. Okay, that was also not in all places, but in multiple places. In the schools, as I said, parents were not even informed. So there were outbreaks even, in the first wave when the whole Europe was upside down. In Sweden, schools were not closed even when, it was spreading around. The communication, for me, it was quite confronting to see that public officials were actually spreading misleading information, often wrong or misleading, as I said. And this affected the global pandemic response as well. Okay, Sweden is a small country population-wise, but they for sure affected the policy in not a favorable way in other countries. So many people denying the pandemic actually use Sweden as the example. Oh, Sweden is doing so great. The extremely polarized climate, so even at university level, it was just not possible to have a discussion. I think any discussions should happen in a scientific setting, but yeah, it was really not possible. It was not discussed, and it was really the public health agency should not be questioned. It did get better, luckily, but it's, especially in 2020, it was not that nice to ask questions like, why is Sweden not following the WHO advice? And another thing, I am a Belgian, so I was living in Sweden, and also from the start they were making comments like, oh, it's only the foreigners who get ill, it's only the foreigners who die. And the state epidemiologist even said oh, it's those who don't manage the Swedish language who brought it into the elderly homes because they are unhygienic. So I still have difficulties to believe that he said things like that and that the Swedish public just accepted those things. Okay, I look like a Swede, I'm not one Swede, I'm European, but it was really creating that thing like it's not happening, the pandemic is completely under control, it's not happening, it's only other people who get it. So how to implement science in pandemic policy making? We heard it actually before. It should not only be infection control specialists, it should not only be epidemiologists, it should be social scientists. Will people adhere to guidelines? The economy should be considered. Ethics. It is needed if resources are scarce. You have to make decisions, but then you should have discussions. You should still try to treat as many people as possible, but then you should have discussions of what you can do and what you can't. Communication is really, really crucial among scientists, among doctors, but also I think to the public, you should inform the public in a correct way. So reliability, there should be national and international sources. So for me, it felt quite normal. I was following the national and international media and of course the scientific advances as well. So for me, that's a natural thing. So there was some discordance with what's happening in Sweden. But then also, you should think about who we were all involved in this pandemic, that for sure. But I think you should really think about different groups because everyone is affected in a different way, especially the healthcare workers, because they're also at risk at work. They have to work. They usually have some sense of duty towards the patients as well, and they are taking more risks than usual. But then also, you have the children, the more frail, the elderly. And another thing is that every single country made mistakes. That's for sure. That's a natural thing. We're all humans. We do make mistakes. But then I think we should learn from them. We should learn from mistakes from other countries as well and be flexible to adapt a strategy if needed. While in Sweden, many people are still shouting, oh, we did it so great, and we ignoring the fact that several things did not go so well. This is actually a diagram not from COVID. It's actually on climate change, which actually illustrates that it should be a vicious circle. You should have evidence. You should reach out to the public. You should engage everyone to obtain change. So to conclude, you have official advice, so-called scientific advice, which is not always as scientific. You have shadow scientific advice that happened in other countries in the world as well, that there were groupings of researchers grouping themselves and trying to discuss and, what is going on. Can we help? I think it is helpful that scientific advice also comes from independent people, so not only from governments and politics. I think also it should be multidisciplinary, transdisciplinary, and many people involved. The more voices, often it can help. And of course, scientific information, knowledge, and understanding are crucial. It's not only the numbers. Numbers can also misrepresented or misinterpreted. So you should look at them from different angles. And a good collaboration, communication are crucial. And as I said, a diverse expertise, coordination, and also someone should be in charge, or a group of people should be in charge to implement policy, of course, as well. So with this, I would like to thank you. And I found these cartoons of an Iranian artist quite early in the pandemic. And I thought this one was quite suitable for this talk today, because the healthcare workers have been doing a great job over the years all over the world. Thank you.